folks. You're listening to the Jobs Podcast. I am your host, Tim Hendricks. Your time is valuable. I'm not going to waste it. Let's get right to the interview. Hey, Lisa, thanks for joining me on the Jobs Podcast today. How are you doing?
I'm good. How are you?
I'm doing all right. I'm looking forward to talking with you. Lisa is a nurse, and we're going to dive into her education, her background, the type of nurse that she is, what a day is like. And so anybody that's interested in a nursing career, this is the podcast that you want to listen to because Lisa is an expert on everything. Isn't that right, Lisa?
Of course I am.
Right. So let's start with the origins of Lisa. Where were you born? Quick snapshot about your family, siblings, where you live. No, I mean, not your address, but the general state. That kind of
Sure. Yeah. So I was born in Lincoln, Nebraska, and I am still in Lincoln, Nebraska. Grew up here most of my life. With my dad's work, we moved for a couple years to a suburb of Chicago and then transferred back to Lincoln. So really, I just grew up my whole life in Lincoln, I say, but I've got an older brother and a younger sister. So I'm a middle child. And yeah,
What line of work was your dad in that took him to Chicago?
yeah. He worked for a ratings company, AC Nielsen's. Kind of advanced and worked his way up. When he left that line of work, he was the branch manager of the office here in Lincoln, Nebraska, and they were closing that office. Their main office was in Fond du Lac, Wisconsin. Is that right, Dad? Yeah. And so I was like, wait, Wisconsin, that didn't sound right. And so we were high school kids and we didn't want to move to Wisconsin. And so
Sure.
he let that offer go to move there and work, and kind of had a second career then at the Lincoln Public Schools here. Drove a bus for a little while, and then worked in the transportation office for the public school system here. So
Cool.
Kind of had two careers.
Yeah. Well, your career, I'm assuming since you were born and raised for the most part in Lincoln, you went through all the way through high school. When you left high school, did you know that you wanted to be a nurse, and then did you go right to nursing school, or did you take time off and just work, or did you go to a 4-year or 2-year college for another degree? How did that play out?
Right. Yeah. So when I graduated high school, I think I had it in my mind that I wanted to maybe do physical therapy, something related, like in the medical field area.
Okay.
Kind of, yeah, I think kind of had that helper caregiver mentality. And so I did attend a 4-year university, the University of Nebraska here in Lincoln. I started there kind of with gen ed type classes. And I also had a desire or fondness from experiences during high school to possibly do missionary work. And so as I was considering doing gen ed in my first year of college and considering the possibility that I might like to someday travel overseas and do missionary work, I thought, nursing would be a really good skill to have in the use of mission work. And so I kind of changed directions, I'd say, early on at college, and maybe at the end of my first year of college or beginning of my second year. And so I did have a bit of a wasted year of college, I would say. Generally, the nursing program at the university here, at that time at least, was about 5 years. And it took me 6. I had taken classes I didn't need. I was kind of taking things I was interested in the first year and a half of college. So then I got more focused, knew what I needed to do nursing, to get into the nursing program there. And yeah, so focused in more on the classes I needed, and applied to the College of Nursing and finished my degree there, technically through UNMC, University of Nebraska Medical Center, but they have a nursing school campus on the campus of the University of Nebraska Lincoln. So
When you go to nursing school, I just know a little bit about. I'll relate it to what a doctor does. They'll typically go through a classroom portion of their education, and then they will have residency where they're spending the majority of
mhm.
their time in the clinics and doing stuff. Do nurses do the same type of thing as far as there's a big chunk of classroom up front and then afterwards it's hands-on type work?
It sort of, but no, it's similar but very different. We do a lot of what we call clinicals,
Okay.
a lot of hands-on education, but they do kind of incorporate that throughout the program.
Okay.
You do have, like I it and it does depend on what type of nursing school you go to, which I can speak to in a minute. But at a university, at a bachelor program at a university, you do take some prerequisites and a bunch of classroom stuff ahead of time, or to get qualified to get into the nursing program. But then once you're in the nursing program, you take courses that deal with several specialties within nursing, like psych nursing, geriatric nursing, labor and delivery, orthopedic, ICU. And during those classes, you would do clinical each semester alongside your classroom work. And so we would have time in the hospitals around town. Also, like public health nursing. So we would work with the health department and do clinical there. So a wide variety of what we, like I said, we call clinical experience in the community, at the facilities in the community, but that is incorporated in each class throughout your education.
So that's not something that you haven't gotten to the I'm going to go down this type of nursing route, whether it's respiratory or post surgical or whatever. This is early on when everybody is essentially
This
doing the
is what
same thing.
everybody,
Oh, okay.
yep,
All right.
everybody in nursing school does this.
Oh, okay. Well, that
Yeah.
probably helps you
And
decide what might interest you, correct?
yes, very much so.
Okay.
And I think it's important and good. And 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 to a degree, we we might see or experience and use any number of those things in any, nursing career and direction that we might choose, or path we might go down. So yeah, so every nurse in school, every student nurse, will get a wide variety of education, kind of the gamut of education during nursing school, so that they are, I use the term loosely, but equipped for whatever nursing job they are hired for
Okay.
going forward.
Okay.
So,
Well, that makes sense. So you've gone through all of your basic classes. You've gotten to kind of dabble in everything related to nursing. It's creating a solid foundation, I would assume.
yes, yeah, it's
Where
a good way
in
to put
the
it.
where in the process of your education do you typically start to take classes that this area of nursing interests me more than those other ones, and I want to focus on this type of nursing?
So that's a good question, and it makes a lot of sense. But the answer is you don't.
Okay.
So you graduate from nursing school, like I said, equipped for whatever type of, well, with a certificate that says you're equipped for whatever type of nursing job you might choose.
You're a jack of all trades
And
kind of a nurse.
a jack of all trades, graduate nurse. And then there is a lot like a most, I think, medical fields. You take an exam, the NCLEX exam, to be actually certified or get your license for nursing. And so you sit for an exam and you have to pass it in order to be a real nurse.
What did you say the name of that exam was again?
NCLEX.
What does that stand
It's
for? Do you know?
nope, not even a little bit. Probably should, huh?
You know what? You
Listen,
got it. So you're good. You've already got it. It doesn't matter what it stands
yeah, I
for.
don't need to worry about that anymore. Um,
Okay.
I've been a nurse for 26 years. That was a
Right.
long time ago, Tim.
Yeah, yeah.
I don't I don't remember what that stands for.
It
I could
doesn't
Google
even
it
matter.
for
I
you.
was just curious. Yeah, that's fine.
Yeah, yeah.
No
But
problem.
it's the nurse's exam that you sit for after school.
Okay.
And so anyways, you, as far as specializing in a certain area, and that's why I use the term equipped loosely. You really, I was surprised when I started my first nursing job, which was on a med surge floor, as we would call it, a medical surgical floor in a hospital. I was surprised how much truly on the job training there is. Like you use the term, like a good base of knowledge, and I feel like that is what I left school with, a good foundation of knowledge. And um, and yet I had a big learning curve when I started my actual first nursing job. So there really is a lot of on the job training, because each area of a hospital, each medical clinic, each area of nursing that you might enter into is so varied and specialized that you really have to, and each hospital does things differently than other hospitals, and uses a different computer program, or
Yeah.
has different policies or procedures. Are the basics the same? Yes, but there is a large degree of on the job training. One thing, to just briefly speak back to your education, one thing I noticed when I started my first job, I had gone to like I said, the university for education, and gotten a bachelor's degree, which I'm glad I did. I like that. I feel like I got a nice, well-rounded education. I like that I got to be at a university on campus with lots of students studying lots of different things. But I will say, like, we have a few nursing programs. In particular, I'm thinking of one that the hospital I now work at has its own nursing school and nursing program. And originally, those students were getting associate degrees back when I was in school. They were getting associate degrees of nursing. And I felt like when I started, the new nurses that had come out of that probably a little more focused program, associates program, seemed like they'd had more clinicals, were maybe a little more prepared for the actual job than I felt like I was.
Okay.
And so I think, even though I enjoyed my college experience and I'm glad I did it that way, I do feel like, from my experience, even continuing on, that a lot of those nurses that are in the more focused, just nursing school, nursing programs are very well equipped to start working as a nurse. They still have on the job training that they need to learn, but I feel like they were more prepared than I was because of their better clinical experience.
It sounds like the 2-year plan is just pretty much we're just going to focus on nursing and nothing else. You don't have a bunch of other classes, which there's benefits to taking other classes, but if you're
Mm-hmm.
just wanting to focus on nursing, why not just go to a 2-year program that's all that you do?
Yes, and I will speak to that again because the hospital I work at, they have changed their nursing program to a bachelor's program, and I think that in general a lot of hospitals are look at well hospitals any lots of employers are looking more for nurses that have that well-rounded education, a bachelor's education versus the associates. And so they are expanding a little bit what their school and nursing program looks like to include some more of the other types of classes, but they still include lots of clinical. The school takes a little bit longer. I believe they have a 4-year program now instead of just 2 or 3. But you're studying alongside nurses. You're all nurses studying together. So I don't know if that singular focus still helps, and then that additional clinical time. Just a thought.
Does the As I'm listening to you talk, I'm thinking, is one aspect of moving to a 4-year program for nursing when you try and move up in the ranks, so to speak, what's after RN? Is it LPN or
Mm.
I don't and then like nurse practitioner, do most of those
Sure.
higher ranking nurses or, higher tiers, do they typically require a bachelor's or even a master's or something along those lines?
Yeah. So an LPN is an associate's degree with a few less. They're educated for a few less skills than an RN.
Okay.
And for a while, yeah. And so nursing does have, beyond a bachelor's, does have a master's degree system that has a few different specialties that you can do to get a master's in nursing. You can be a nurse practitioner, you can be a certified nurse midwife, you can get a master's in nursing informatics and kind of focus more on the computer aspects of things. There's those few handful of options for masters in nursing, but there is also within nursing some hierarchy if you want to and then nursing administration also is another master's you can get in nursing. But like if you want to do your time and get your experience as a in a hospital as a floor nurse, like where I started, whether it be on a medical unit, a cardiac unit, a surgical unit, in the ICU, any of those things. But then your hope is to maybe move into more management type positions, excuse me, or nursing administration. Then for sure, if you were moving into management, they would want that bachelor's degree.
Okay.
And I have seen through my career, and I don't know if they'd be more strict about it now, but through my career, I've seen maybe a nurse get hired as a manager that has an associate's degree with the caveat that they would be working towards their bachelor's
Okay.
as they move into that position. But then the master's degree programs is where you would specialize quite a bit more for some more specialized positions within nursing. So,
You had talked a minute ago about being a nurse on a floor or in a cardiac unit. Is that
mhm,
where, so you've graduated from either whatever program you've graduated from, and now you are licensed in some capacity to be a nurse? Then
mhm,
do you go and apply for just an entry level position on the floor? Or, I mean, what kind of options do you have when you're new and you're wanting
sure.
to, let's say, years ago I had to get allergy shots and they had nurses
Mhm,
that were at the allergy clinic. They were all
yep,
older nurses that had been doing that for a number of years. But let's just
sure.
say that that's where I wanted to end up as a nurse, but I just finished school. What would
Mhm,
be a typical path to go to end up in whatever specialty you wanted to end up in?
sure. That's a great question. And I think anymore that can look really different for each person, but it probably depends on the management and the people in charge of those areas. It used to be that some of those positions, because like in a clinic where you don't have to work the night shift, you don't work holidays, they're closed on
Right.
those types of things. For those reasons, plus the a little bit lighter workload, would be more coveted positions, and so they could afford to hold out for some more experienced nurses for those positions, because experienced nurses are going to want some are going to want those positions
Right.
to get out of the heaviness of working in a hospital, working day and night shifts, rotating shifts, that type of thing. But anymore, I think some places are willing to hire new nurses more than I feel like maybe they used to be. It just depends on the management.
Okay.
So I would say, but personally, my personal opinion, I think I gained so much valuable knowledge, understanding of human anatomy and physiology, of basic nursing care, and some not so basic nursing care by starting out on a medical surgical floor at a hospital, which was my reason for going there. I originally, while in nursing school, thought, oh, wouldn't it be so fun to be a labor and delivery nurse and work with babies, and which would be so fun.
Yeah.
But I thought I really want to get a good base of knowledge of like working as a nurse before I specialize so much into like pediatrics or labor and delivery, that I chose to go to a med surge floor and apply there. And then I fell in love with medical surgical nursing and wouldn't want to, maybe, well, I'm not sure I'd want to do anything else. And so that was just my path. I thought I was going to go one route and ended up loving the first step and not wanting to go on to the other things I had in mind. But I do think that there's value in working in a hospital, seeing patients when they're
Yeah.
sick,
Mhm.
and learning some of those skills and critical think, like actual like procedural skills, but also critical thinking skills. Um, yeah, just all those things before you move on to something a little more specialized, I guess. But
Right.
that's my opinion.
Well, I think
I
it's a
know.
I think it's a good one, Lisa, because if you think about how much you have learned, and then a lot of folks like to move up the chain, but I think sometimes people are in such a hurry to get to the top that they don't learn the foundation. And you're going to end up
Mm-hmm.
being a better supervisor, manager, and leader if you know the roles, or at least have a somewhat of a familiarity of what people underneath you are doing. If you
Yeah.
just bolt to the top and you don't learn anything below, it's hard to manage when you can't relate to what they actually have to do day to day.
Yeah. Yeah, I think so. And even like currently now, I am working in an outpatient surgery setting at the hospital that I started at. So I've been with the same hospital for my 26-year career, but have moved from working with post-op patients on the floor that stay for several days to the outpatient setting where we get patients ready for surgery that are scheduled for the day. And then some of them go upstairs and stay overnight, and we don't see them back to our area. And some of them go home the same day, and we would get them back, recover them, educate them, and send them home that same day. So we work closely with the surgery department. And I will say that historically, what I noticed early on being over there is that the surgery department and like the ICU, where the patients are a little more critically ill, would not usually hire new grads because they appreciated having those nurses that had worked other places first, had gotten their feet wet in nursing and developed some of those critical thinking skills and hands-on nursing work before they came to work in those, yes, more specialized, but maybe a little more critical care departments. But I have seen over the last several years that has changed some. We have seen, and maybe that's due to nursing shortages and just no other choice. And but I think too, I think they just we have good nursing oversight and training on the different units, but they are now, I'm seeing more new grads hired to the surgery department. Now, I wouldn't say a lot, but I would say more than I've ever seen before, or hired to the straight to work in ICU for their first job. And that's maybe a little less common, but they spend the time. Sometimes I know in the surgery department, there's a 6-month training period to come work in surgery as a nurse. And so they take the time to train and educate even on the job. And so they are more willing to hire new grads to some of those positions.
Do you think that the folks that may be new, but they get hired into some of these more specialized or coveted type positions, I don't know how to, is it like the draft where they're going through their schooling and the administrators are like, this one over here has got what it takes. And this one over here, he or she sees blood,
Mm.
they see blood and they, their knees get weak. And, is there some people just kind of rise up and they just gravitate towards it and it's a natural thing for them, and other people, it feels like it's more forced? And do you just kind of see those people? What's the word I'm looking for? I can't think of one, but you know what I'm trying to say.
I do. I don't know that there's that much communication or from like nursing school professors to managers on the units of the hospitals. And I'm sorry, there are so many routes to take in nursing. I just have been in the hospital setting my whole career, so I tend towards talking about hospitals. But
They're not sending scouts over to the nursing schools to see it.
no, no, no. But we do. we do see a lot of the students coming to our areas for clinicals. And so we will like we we start a lot of IVs in outpatient surgery because people are coming in from home and all of them need an IV for their surgery or procedure. And so we get a lot of nursing students come to spend 1 or 2 days with us just to start as many IVs as they possibly can. Yes, also see our setting, but like, let's get you some IV starts because this is where to practice and learn. And so, but we also see, and we'll say to our managers, like, hey, this student was awesome. If we ever get a chance to hire her or him, do it. They're great. Great at starting IVs, yes, but like go getters, jump right in, want to help out, go above and beyond even what, you know, typically, others would just might sit around and wait for a chance to start an IV, where this one over here is like, what can I do to help? And so
Right.
we talk about that, I think, some, but I don't know that there's like a lot of back and forth between managers at the hospital and the professors at the colleges, just from what we see of them as students that come for clinical.
Well, and there could be someone that shows up that maybe, thinks they want to do it and they grow into the profession and they kind of get their stride. Maybe they're a little shaky at first, but then they get their stride. And other folks are just dead set on it and they get 6 months into it and realize this just isn't for me. I don't think I want to do this. What you just said a minute
Yeah.
ago, when you see people that come in and they're go-getters, and I know you listed a few things there, but are there any other things you can think of if someone was listening, they're thinking about, I want to get into nursing, but I don't know what can I do to set myself apart from my peers, and what little things, like the soft skills that you hear, CEOs and stuff like that talk about, showing up on time, asking for work, being curious but not
Mm.
obnoxious. What kind of
Mm-hmm.
things when you see a new student come in and they're just rising above everybody else, what can you what advice can you give someone who's coming in that wants to be the best?
Sure. Yeah. So, I mean, I think I speak for myself and my peers that I work with currently, but we want to see go-getters that want to get in, get new experiences, try something new, not afraid to ask questions and be curious and teachable. We really, really appreciate people that are teachable.
Right.
Even when I have a new coworker come in that's been hired to work with us, and we're training them to the specifics of our area, even if they're an experienced nurse, I feel like nurses need to be teachable, like as a lifelong trait. It's so beneficial because nursing is always changing and morphing, and new technologies and new research, and we learn so much from each other, and so much as things change and we get new equipment or new procedures. So really, I think the most important thing in nursing is to be teachable, which a portion of that requires a little humility too,
Yeah.
to be a little humble and like, okay, I don't know everything. It is a little frustrating when people come in and act like they know everything.
Yeah.
And I've worked with some really smart nurses, and who I feel like know just about everything. And they've been so teachable and humble and like, okay, I haven't done this before, or I haven't done this procedure since I was in nursing school.
Yeah.
We were just talking about that at work today, and this procedure I would be less comfortable with, and or like if a patient came in that had a implanted port for an IV, and I didn't have a lot of experience with those throughout my career, but two of my coworkers worked on a cancer floor where they used them every day before they came to this job. Like, to be able to say, hey, will you just come in with me while I do this? I haven't done one in a while. Or do you have time to just go start that or access that port for me, since you're the expert in our area for that? Like, yeah, I'll go do that and you do this for me. I'm finishing this up with another patient. Will you just go take care of that and I'll go access your port? Like, that willingness to help out and be an expert in some things and know that you're not an expert in everything. And in that, in saying that, as what I was just describing, just an ability for good teamwork, like
Yeah.
a willingness to have good teamwork and be a part of a team, not just among nurses, but we interact with so many other specialties, not just the doctors and the surgeons, but respiratory therapists and phlebotomists that come from lab that come to draw blood, and vascular techs. I mean, just like, we have such a wide variety, chaplains, I mean, of people that we have to partner with and be in cooperation with. So yeah, just that teachableness, but also a sense of teamwork and willingness to do your part, I guess.
When you've got a team like what you were just describing with all those different specialties, and then each member of that team is putting their best foot forward or stepping back to let someone who's better at something else, that's how you provide the best care for your patient. That just seems like a no-brainer to do that, but unfortunately, sometimes people's egos get in the way, so it's commendable that you approach it
Sure.
that way.
Thank you.
Yeah, you're
Yeah, and
welcome.
I
Good
work
job,
with some
Lisa.
really good people.
Yeah.
Well, thanks, Tim. I work with some really good people too that and I mean, I don't know if we've just hired well or it's part of entering into the culture of the area that I work in, but have really created just a good teamwork culture where, yeah, we want each other to succeed, and when we want our patients to have good care, so and have good outcomes, and so we help where we can, and also ask for help when we need it.
Right. Earlier in our conversation, you mentioned something about a shortage of nurses.
Mm.
I've heard that comment a number of times for, well, a long time. Is that just a chronic problem in the healthcare industry?
I don't I don't know it. Yeah, chronic maybe is the right word.
Okay.
It ebbs and flows.
Okay.
And I remember in nursing school, and I've seen it. I don't know where we're at lately, but I've seen it over the years where, at least when I was in school, they said it's usually about a 5-year ebb and flow. Like,
Okay.
about every 5 years, we're short of nurses. And then at the end of the 5 years, okay, now, we've got a bunch of people coming out of nursing school. We've got nurses galore. And so it's a chronic cyclical issue in nursing, I would say. And I don't know. I don't know how or if COVID affected that. I think it lended towards an admiration for the field.
Sure.
Um, but I don't know if it made anybody want to be a part of be a part of it. I honestly
Right.
don't know.
Yeah.
And I will say, in saying that, I will say nursing is not for everyone. You have to have a little bit of tough skin,
Yeah.
and just just for the work itself. People that are in the hospital or coming into a doctor's clinic, or even just coming in for an allergy shot like you shared, it's generally not their favorite day or their favorite thing to do. I would say rarely do I have people coming in going, yes, I'm at the hospital again.
Right.
So, that's one of my favorite things about nursing. I like to be, it's kind of my personality, but I like to be able to, sit with someone on maybe their worst day and just try and make it a little less painful, a little less excruciating, a little less terrifying, whether that be just through listening or through education or through just gentleness or kindness. But I don't remember what we were talking about.
Nurses, a shortage of nurses, and
Shortage.
ebb and flow and all that kind of stuff in the
Yeah.
market.
COVID. I was talking about COVID.
Right.
And nursing's not for everyone. But yeah, you encounter people when they're a lot of times at their worst, or certainly not at their best. And so you have to be able to, take a few punches when they're, upset or yelling at you, or their family is. You have the family also to deal with. They're upset, and why is surgery delayed, and I don't understand this, or and nurses are the ones that are in their face when they experience these delays or bad news or pain, or we're the front line.
Yeah.
And so we're the ones that get to explain and hedge and ask them to be patient and sympathize, and so you do have to be able to handle a little bit of that, I guess we could call customer service, in a sense.
Right.
But then with just patients and their family members, but then also with doctors, we have some wonderful doctors at our hospital, but every community, just by the nature of the medical field and doctors, is going to have some doctors that are difficult to deal with, that have chips on their shoulders, or nurses, or in any field, but chips on their shoulders, who will always find something wrong, and honestly, saying that out loud, I think that can be in any field where you're going to have those different personalities. But I think there is a higher degree, I may be completely wrong, but a potential for a higher degree of arrogance in the field of doctors, in that field.
Yeah.
Which, I mean, you want a confident doctor taking care of you. Trust me.
Yeah.
So
there's also an arrogant doctor.
There is a goodness, there is a rightness in a confident doctor, but it can sometimes, overflow into arrogance, and because they're usually very intelligent, not all of them have a great bedside manner, but that doesn't mean they're not a great doctor. I mean, and so, yes, in that field, you're going to encounter wonderful, pleasant people to work with and difficult people to work with. So, in that sense, you got to have a little bit of a tough skin. And then beyond all of that, the people part of it, there's blood, there's guts, literally. There's poop.
There's poop. Yeah, so much poop.
There's vomit. There's, so you have to be okay with those things, or get okay with it, if this is a field that you're interested in. So
the traveling nurse, I've heard that pop up in And I work with a lot of firefighters who just by proximity to nurses end up marrying nurses. And
Mm.
the traveling nurse thing always has kind of a this allure because, everybody thinks, well, I'm going to go to Hawaii and be a nurse and make a ton of money. And, you know, is the traveling nurse thing all it's cracked up to be? Do you know much about it, or do you know anybody that's done it?
Sure, sure. We've used traveling nurses at our hospital. I have friends or coworkers that have gone to do traveling nursing. So, allure. So so here's the allure of travel nursing. Because I will tell you that the majority of travel nurses that I know, um, like are nurses in Lincoln that find out they can make more money doing travel nursing by traveling, quote unquote, to work at a hospital in Omaha. And so,
Oh, okay.
most people do travel nursing for more income, and I would say the not a lot of people do the glamorous, I'm going to visit all the pretty places and the pretty people and be a nurse while I'm at it.
Mhm.
People do that for sure. But a lot of people that are nurses have families,
Right.
so it's not like, I'd say that type of mentality for travel nursing is more the younger single people in the nursing field. And it would be, I've thought about it. I thought that would be fun at one time, but life and family things happen,
Yeah.
and home's really kind of nice. But I will say, so usually for travel nursing, what I know about it is that you sign up with a travel nursing agency. You get your benefits, your health benefit, like health care and everything, through that agency. And then they tell you here, which places have openings. And usually travel nursing is used, I know how our hospital has used it, is to fill nursing shortage areas in a pinch.
Okay.
And so the nice thing for hospitals about travel nurses is they come in, they get 2 or 3 days of training, and then they're in the job. They're working. There's a shorter training period. They come experienced in the area that you've hired them to work in. So, for example, in the surgery department, we've used some travel nurses, and they would need to have experience working in surgery before, because they literally come in and get 2 or 3 days of training, and then they're on their own.
So
I
this
mean,
isn't something that a brand new person right out of
no.
nursing school is going to do. This is someone who's got some time under their belt.
Yeah, at least a little,
Okay.
to where you can walk into a job with just a few days training and
Okay.
hit the ground running. And then usually I think it's usually like maybe a 16-week contract. And then you you work full time usually for those 16 weeks. They do pay quite a bit better, like a degree, like I don't know the numbers honestly, but a degree or a percentage more than getting a job in the hospital the traditional way would,
Okay.
um, to have you come in and be able to hit the ground running. And then also you would have like a stipend for housing, and your hours would be guaranteed. So,
Do
and
you
then at the
typically
end of the
get
six,
do you get benefits with that with the traveling thing? Is it for the hospital you work for? Do you know that?
not from the hospital.
Probably for the
So the
agency that
hospital
you work for.
also, yeah, the
Oh,
agency.
okay. All
So
right.
the hospital also then for those traveling nurses, yes, they pay them a bit more, but they don't have to provide benefits. Yeah. And so if they get their benefits through the traveling agency. But yeah, so you could then, if the hospital is still in need at that time, you could I've seen people renew a contract for another 16 weeks in the same place, or you could, you know, towards the end of your contract, start working with your agency to find the next place you're going to go.
Okay.
So,
It's an option.
yeah, yeah, yeah.
Hmm.
And it works for some people.
Sure. I mean, it's probably a good way to maybe see the country or see the world. I don't know if you can travel overseas to be a nurse if you're certified in the United States. Reciprocity may be a whole different discussion that we don't have to dive into now. But
Sure.
one of the things that you mentioned back, you talked about your training that you got initially, and then the things that are changing in the healthcare industry as far as new
Mm-hmm.
skills, new devices, and whatnot. I'm assuming you have CEUs, continuing education classes, or online training you have to do periodically to keep your license or renew your license. If there is a new
Yes.
device or something that comes in, do they have a rep from a company come and say, hey, we're using a different type of airway or a different type of IV port or whatever, and this is how you use it? Is that how that's typically handled in your line of work?
Yes. Yeah. So if we're changing, like you said, changing IV kits, um, the company that they've chosen the new product from would have people come in, reps come in and educate us on the new device and how it's used, the benefits, and then they usually hang around like the first week we're implementing it, hang around for that week or two just to troubleshoot if there's any issues.
Okay.
And it's good you brought that up just because a lot of times, and not always, but a lot of times that is another avenue that nurses can take. A lot of times those reps for drug companies or medical device companies, a lot of times the reps that go out and do the training and education for their products are nurses or
Okay.
were nurses.
Okay.
And so that is another route. There's just the one of the nice things I would be remiss in if I didn't share before our time is done that one of the best things in nursing, in my opinion, is the variety of options with a nursing degree.
Yeah.
Because, if you do, even me, like if I were to do this job that I have with the hospital in which has the whole time been in and around the surgery area, but in a couple different positions, and I love it, but let's say I hit 30 years and I'm burnt out. I've had two back surgeries. I hurt all the time. I just need something different. I have so many options. I mean, I could go work at a doctor's office where there's not quite such heavy lifting with patients. I could go be a drug rep. I could go work. We have a area where for surgeries where nurses make call patients a few weeks before their surgery to get all their health information, and they work at a desk and a computer and doing phone calls all the time and don't do any one-on-one patient care, and they're nurses. I mean, so and there's probably so many things that I'm not even thinking of, but there are so many options
Yeah.
for people with a nursing degree that if you get burnt out in one area, you don't have to leave the field to find something different enough to continue to enjoy your nursing career.
If you're an adrenaline junkie, you can go work in the emergency room, and if you're real low
Hmm.
key, then you go work with the narcolepsy wing. I don't have any idea, but there are
Exactly right,
a
Tim.
m- a million different options. I mean, just think of
Yeah.
the size of your average hospital and all the different
Hmm.
divisions and all the different diseases and specialties. Yeah, it's endless. I
Yep.
can. That's a really
Yeah.
valid point. You can find what will make you happy for sure.
Yep.
What
For sure.
What would you say if you had to just choose one thing that you like about your job the most? What what would that one thing be?
Hmm. You know, I, when I fill out my yearly evaluations and I get that question, I always say that I love my coworkers the most, and it's true.
Yeah,
I think I think if you get a good work group and you have that teamwork and that let's help everyone succeed mentality, it's
camaraderie. Yeah,
such a yeah, it's just such a it makes you not hate going into work.
right.
It makes you enjoy going in and seeing people that you like, even if they're not people you hang out with outside of the work setting, people you like that you can enjoy the work together. But I think my beyond that, I think my favorite thing about nursing is kind of, I mentioned it already, but just that ability to sit with someone, to work with someone on maybe their worst day and just make it a little better for them.
Right.
Ease their pain a little bit, ease their anxiety a little bit. Just listen, even if I can't do anything about what their struggle is in that moment, just be able to listen and empathize and say, I'm sorry that this is happening, and just maybe help make their day a little less awful than it could have been otherwise.
Right. On the flip side of that question, what's the one thing that you dislike about your job the most?
So it's a little bit going to be the same as my first answer to my favorite thing,
Mhm.
because in general, not exclusively, but in general, nursing is a predominantly female profession.
Okay.
I work with a lot of women, and I think they're awesome and I love them. But there can be a lot of drama. And so I I don't like the drama. I like to come to work and do my job and take care of my patients and have fun with my coworkers and enjoy the work.
Right.
And when there's some new drama, it just can ruin my day.
Yeah.
And so yeah, I think, but also, you know, uh, you know, depending on your management, who you work for, there can be also just the politics in the hospital, I
Yeah.
guess I should say.
Hmm.
The politics of that you might find in any workplace.
Sure.
The politics of things can be kind of irritating, and women can be kind of irritating. I'm sure you don't experience that ever, Tim, but
Never. No. I would.
never.
I would have to disagree
So
with you, Lisa.
I'm telling you something new.
This is new, shocking news to me. I
New
really.
information.
I'm gonna have to dig into that for a future podcast.
breaking breaking news on the job podcast.
Oh boy.
Women can be catty.
You heard it
But,
here first,
I
folks.
mean, and I think women are the hardest on other women.
Yeah,
And so, when you have a bunch of women in the workplace, it can get ugly sometimes, which is why I'm so thankful. I really work with some great people, but we all have our good days and bad days.
sure. What Has there been one particular, I guess, industry change or a new
Mm.
device or technique that is now just considered standard, commonplace, everyday part of your job that when it first was brought onto the scene was just like, this is like magic. And now it's just kind of what you do because healthcare has changed so
Mm.
much. You know, you're a family friend of ours and you know about our
Mhm.
son and his organ transplant when he was younger. And if you look
Sure.
at that was, 14 year almost 14 years ago now. And if you look at what an organ transplant was like 30 years ago, it was like meatball surgery compared to what they did to our son. And then now what they
Mhm.
do now, it's, they just give you a pill and all of a sudden your organ's fixed. I mean, I'm joking, obviously, but
Right, but
the
yeah.
advancements in medicine are just pretty crazy. And what we take for granted
Mhm.
now was cutting edge 20 years ago.
Mhm. Yeah. I feel like so much has changed. I don't even know. But as you were talking, I think what I would say is the biggest change in my field of work for nursing that I would not have even believed when I first started was just like hospital length of stays, like for surgeries. Like surgical patients that would have stayed when I first started nursing would have stayed like 1, 2, 3, 4 nights in the hospital are going home the same day of
Jeez.
surgery. When I worked on a general and vascular surgery floor, we would we would keep we would have lap choles stay overnight all the time. And now it's like, which is, I'm sorry, a gallbladder removal.
Right.
And now it's weird and crazy if they have to, something's gone wrong.
Right.
Well, that sounds bad too, but like something's, not going smoothly to where they have to stay overnight. We do a lot of neurosurgeries, back and spine surgeries at my hospital where I work, and those patients always used to stay overnight, even at least one night, even 5, 6 years ago. And now we're sending spine surgery patients home the same day. Like that that has been kind of baffling to me as I've worked with in the surgery realm over the years.
Do you think that that's a result of the procedures being refined and the tools being downsized as well as pain medication control, or is it just the whole package, everything around an operation like that has just gotten better?
hmm I think everything. I think all of it. I do wonder sometimes how much insurance companies have input on some of those things too.
Ah, mhm,
We've got a patient that's supposed to go home the same day. They're back from surgery. They're doing okay, but having quite a bit of pain.
yeah,
They're not sure they're comfortable going home. We call the doctor. Hey, can we keep this guy overnight? No, his insurance won't pay for it. Give him this. Now, if there was something really wrong, they could stay overnight. But
right,
like just having a little pain, need some more pain medicine. No, that's not gonna fly with insurance.
right.
Try this and then send them home.
Here's a little mud,
And
walk it
so
off.
yeah, yeah, rub a little dirt on it and put them in the car and ship them home. But I do think, with the yeah, I mean, I don't know how much smaller the instruments are, but incisions are smaller. They're able to do more in smaller spaces. There's a lot more robotic surgeries. And so they're using robots to and just have puncture sites for incisions instead of a one long incision and opening up. They have like 4 or 5 small little puncture site incisions that either they've done a laparoscopic surgery by hand or they're using a robot to do the actual holding of the devices that do the surgery
Hmm.
laparoscopically.
Man.
Yeah, so I think it all plays into it.
Yeah. Have you ever had anybody in your career, you've been doing this for quite a while now? Was there anyone that you spent a lot of time with that became a mentor or someone early in your career that took you under their wing and kind of said, look, you want to do it this way, do it that way. Just kind of follow me, and maybe someone that guided you in your journey?
Hmm. Yeah, I mean, I don't know. I mean, yes, I would say that when I first started in nursing, because we learn so much on the job when we first start, my preceptor, we call our trainer a preceptor. My preceptor during my first job, Christine, I would say she took me under her wing. I mean, it was her job, but she was assigned to train me. But she's someone that even once I was done training, really, I would look to when I had questions. She kind of helped me be more comfortable with things I wasn't comfortable with,
Right.
and help me see that it doesn't have to be hard. It doesn't have to be scary. But also, there were so many nurses that I worked with initially in my first job that really were admirable in their work, that you could see cared for the patients, that would sit down and visit with the patient, even though our work is busy and hard and there's not a lot of time, would sit at the bedside while they were, back when we were doing paper charting and not everything was on the computer, sit
Right.
and fill out the assessment on the paper charting while you just visited and listened. And Christine did that all the time. One of the nurses that worked the night shift, Michelle, she would give every single one of her patients um, a, a back massage, with like rub lotion on their back and give them a back massage at bedtime. And just those little glimpses of genuine care
Humanity.
and yeah, giving people humanity. And that's a great way of putting it. But like, just made the job maybe not, for sure, not more glamorous, but more compassionate and with more humanity for me.
Yeah.
And I try to emulate them as much as I can. Yeah.
Did any of those mentors, or would you have any advice for someone that's a new nurse or is just getting started? What is the best advice on how to deal with failure? Because we all make mistakes. We're all
Mm,
human beings. No matter what job you're in, at no matter what level of that job you're in, you will make mistakes.
yeah.
How,
Yeah. For
and
sure.
especially in the nursing environment like that, sometimes it can be painful for someone on the receiving end of a stick that you just can't get, for example. That's just one example, but how can you
Yeah.
best advise a new nurse on how to deal with failure?
Hmm. Yeah. I mean, you're gonna have failures. I th- that's interesting because I don't think of not getting an IV stick as a failure. And that's day-to-day life, right? And yes, it's not fun for a patient, but every
Yeah.
patient comes with different bodies that are either hard or easy to work with. But, you know, for us, failures can be, yes, they can cause someone a little pain, some pain, but our failures sometimes can be even a little more dramatic, you know, and so, maybe giving the wrong med to the wrong patient, or
Right.
giving too much of something to a patient, or not measuring correctly, or can be a little more dire. And so it is scary that there is some fear of failure in the job. And so, yeah, I would say that normally I think is what's good is our documentation. Like, it's like, okay, that happened. Let's follow the process for what we do when a failure happens, and kind of make it more about, whoa, you could have really hurt that person. Good thing we didn't, but more like,
Yeah.
okay, so you made a mistake. Let's go and fill out the report, the incident report, and what's our next step? So who do we call? Let's call the doctor, let them know their patient got the wrong medication. They're going to give us some orders for what to do next. So I think, like there's a process in all of this because mistakes happen. And so I just encourage people to learn from it
Yeah.
and do better next time, right?
Hmm.
So, you give the wrong medication to the wrong patient one time, and for the next 5 years, you double, triple, quadruple check
Oh, yeah.
every med, every patient. You're so terrified that that's going to happen. Not terrified, but it reinstills the preciseness of your work, your diligence to make sure you're checking all those things before so that doesn't happen again. And honestly, it's a good thing. It's a
Yeah.
good thing to have your diligence be in check, to have an instance where something has caused you to be more diligent.
Yeah. I get your attention
And
for sure.
so, yeah, for sure. I had an example for me. I We usually use some numbing medication with an injection, a small injection, before we start an IV. And I had not properly capped the little needle I'd numbed someone with. And we would sometimes, if we didn't get the IV at first, we would numb again. And so I had accidentally, out of my own habit, left a small needle, a syringe with a needle on it, on the bed to start the IV. And then I went to pick everything up and I stuck my finger with the needle, which had not been in the patient. And so, because of that, then we have to, if the needle hadn't poked the patient, then I put a band-aid on and I'm good to go. But because the needle had already poked the patient,
Hmm.
then I have to go through, call my manager, go up to employee health. They have to draw some blood. And then I have to talk to my patient and say, hey, they're gonna come test you for like HIV and a few other things, just to know if I'm at risk by being stuck in the same needle as you
Yeah.
for having an infection.
Hmm.
And I tell you what, every time I started an IV since then, and that was a lot of years ago, I properly dispose of my needles before I continue on with the IV start, my numbing needles. And so, I feel like that was a good thing. I mean, luckily I had a good outcome. Like, my patient didn't have any infectious diseases. I didn't get any from that needle stick. So that, I mean, it helps that I didn't have any bad outcome from that incident. But now I always properly dispose of my needles to avoid those needle sticks. So
Yeah.
mistakes happen, but
Hmm.
they're good for learning,
Sure.
I guess I should say.
No, that makes perfect sense. And, it's not always the patient that could be the one that's in danger. The PPE and the policies and procedures and steps and everything are in place, not only for the patient's safety, but for the employee's safety as well. So,
Yeah.
One
100%.
question one question that I didn't dive into, and I know that, it's a big part of this podcast is pay. Now, I never
Mm,
ask the person I'm interviewing what they make, but do you
yeah.
have any idea what, and I know that
Mhm.
it can be regional. A nurse in California or in New York is
Very
probably
much
gonna
so.
have a
Yeah.
much higher salary than someone in Nebraska. But
Yep.
what would, uh, at the hospital you're at or in your region, do you know a ballpark of what a
Mhm.
nurse would start out at?
Yeah, and we did just have an adjustment. And so I'm not 100% sure of what the starting out part is, but it is very, very regional. So you're right. In California, a nurse can expect to make a lot more than a nurse in Nebraska, just like a teacher in California can expect
Sure.
to make a lot more than a teacher in
Yeah.
Nebraska. But but I believe our range, which was just they did a market adjustment recently to be more in line with other hospitals in our region of the same size and whatnot. And so I feel like a new nurse can expect in a hospital, because that is a caveat, can expect to make I I'm guessing on the bottom end, but maybe 38 to $60 an hour.
Okay.
And then but like if you I feel like you do get paid, the ranges are do vary based on the setting. So like if you were working in a doctor's office, it would you wouldn't make quite that much. Maybe even as even as a having a bachelor RN bachelor's degree, you
Mhm.
might only make, 25 to $30 an hour in a doctor's office or clinic. So it does vary by setting.
Do you typically work I know if you're in an office, a doctor's office that's open Monday through Friday, 9 to 5 kind of a deal,
Mhm.
that would be a standard schedule. But if you work in a hospital or if you're on a floor like yourself, do you work different shifts like a 10 or a 12-hour shift, or and I'm assuming
That's a great question.
overtime's an option as well, I would assume.
Yep, yep. So I would say in almost every department in the hospital, for sure, like on the nursing units on the floors where the parts of the hospital that are open 24/7, um, the nurses do 12-hour shifts. So at my hospital, they do 7 to 7,
Okay.
either AM or PM. And the benefit to that is, the less turnover of nurses, then the better for the patient. Hand off here, if you're handing off report on a patient every 6 or 8 hours, then the continuity of care is
Right.
diminished.
Right.
So all of the nursing floors do 12-hour shifts for the nurses. The department I work in is one of the exceptions. So the procedural departments, like the cardiac cath lab or outpatient surgery, where we have areas that close at night. And so we're not open 24/7.
Okay.
So we do have different shifts. In my department, just as an example, and I'm not sure, the cardiac cath lab, they may do like 12-hour shifts but just daytime. I'm not sure.
Okay.
But for example, in my department, because we're prepping people for surgery, and first surgeries in the morning are at 7 or 7:30, patients start coming in at 5:30. And so we work from 5:30. We're open from 5:30 in the morning until 7:30 at night
Good
is
grief.
our posted hours. No, we don't work, but that's the hours that we're open.
Okay. I was gonna say
And
that's a long
so,
day.
yeah, that would be a long day. But that's the hours we're open. And so we have the majority of our people come in at 5:30 in the morning, and work anywhere from 5 hours because it's just busy in the morning. So we have one 5 hour shift person, 8 hours, 10 hours, and we have one 12-hour person. And so like 5:30 to 2, 5:30 to 4 are the most common. We have one person that does 5:30 to 6 p.m. And then we have an evening shift that comes in, and they work 11 to 7:30. Sometimes when we rotate into the evening shift, we do like hours. So maybe a 10-hour shift person might do 7 to 7:30, or that's a 12-hour, 9 to 7:30, but
Okay.
9 a.m. to 7:30. But because we close at night, we do have varying shift hours. Now, there are some hospitals, I'm sure, even across the nation, that do 8-hour shifts, even for floor nursing, and typically an 8-hour shift in nursing would look like 7 to 3, 3 to 11, 11 to 7
Would you get a shift
is what I've,
differential in pay if you're working overnight or on
and
the
you
swing
do
shift?
get shift,
Okay.
you do get shift differential for, overnight. Yeah. For the evening and overnight. In fact, so since I go in at 5:30 in the morning, from 5:30 to 7, I even get the nighttime shift differential for the first hour and a half of my shift every day. So, and then yes, there's opportunities for overtime, and that's handled differently in every hospital and every setting. I can't remember what they're at right now, but sometimes that's time and a half. Sometimes that's a flat rate, maybe like $10 extra an hour for hours that you work over 40. But typically, like starting out in a hospital, most hospitals call, at least our hospital, we would call 3 12-hour shifts a full time. So,
Okay.
which is technically 36 hours, but you're expected to come in 15 minutes before your shift. So like 6:45 to 7:15 is really technically what you're scheduled. So that ends up being a little closer to the 39, the 40 hours.
Yeah.
And so it would be considered full time doing 36 hours in 3 12-hour shifts.
Do
And
most
that's how
nurses
it is at the
do
hospital I work at.
do most nurses try and get their 3 days, or is it typical to just do 3 days in a row, or do people like to separate it up, or is it just depend on the person and the scheduler?
Yeah, I would say that it at my hospital, it depends 100% on the scheduler.
Okay.
It's very like you don't really get to pick and choose your schedule.
Okay.
But by doing that, it gives more flexibility to the scheduler, but also for people to take time off. Like if you don't have a set schedule you're working, maybe you're requesting off for a trip, and you can work 3 days at the beginning of one week
Oh, yeah.
and 3 days at the end of the next week and have a whole week off
Sure.
without actually missing a shift. So by kind of having so you would have a different schedule each week.
Right.
That's where I work. Now, I know some hospitals, and one setting I haven't mentioned that's another big time nursing setting is like a nursing home. A lot of some of those settings and some hospitals have like a line, I've heard people call it. I've never worked in that, and that's under that format. But like they might have a nursing line, a schedule line where the line I was hired to is three these 3 days, like for a 4 week schedule or a 6 week schedule. I work this many weekends and this many night shifts and these days this week. And so maybe it's not the same every week, but every 6 weeks it's the same. so you can plan a little bit. Does that make
Okay.
sense?
Yeah, it does. I can relate to that. Just the fire service schedule is an odd one that most people can't relate to. And those,
Sure.
when you work in an industry that is a 24/7 operation, holidays don't matter, and
Mhm.
it's just always a machine that's moving. You have to get creative with
Yeah.
the work schedule. So it makes sense to me, but it's good information for someone who's listening that is trying to decide if nursing is something they want to get into. That's the kind of nuts and
Mhm.
bolts that you want to know, and how to
Yep.
make that unusual schedule work to your advantage. Like the example you gave of working 3 days on the front end and then 3 days on the back end. You've got a big chunk of time off. You could take a vacation. So,
Yep. Yep.
Lisa,
Yeah.
this has been really eye opening for me. I've known a number of nurses and spent a lot of time in the hospital with my son. And, I have a
Yep.
lot of admiration for nurses, but you don't ever really know what it's like when they leave your room,
Mm.
what they're actually doing, and the schedule and the pay and the education and all that kind of stuff. So you have provided a ton of excellent information. So thank you for doing that.
Yeah, I'm happy to do that. I hope it was helpful and enlightening.
It was.
I'm sure there's so many things that we didn't talk about, but it's a picture,
Yeah.
a snapshot.
Yes. So far, you're the best guest I've ever had.
You're just saying that.
I say that to every guest.
Uh-huh. Uh-huh. That doesn't
Thanks.
surprise me, but I know you actually mean it when you say it to me.
Right. I do. Thanks, Lisa.
Mhm. Yeah, thank you, Tim. Thanks for asking.
Mm-hmm. And that wraps up another episode of the Jobs Podcast. Thank you so much for joining me today. Hopefully you found that interesting. As always, I wait until the end of an interview to ask you to like, subscribe, and share. I feel it's important that I earn that support from you. Thanks again, and we will see you on the next one.